Sure, I would like to highlight the efforts by many colleagues, including the authors of an important abstract at ASCO 2021 from the ASCO Registry. Malham and colleagues presented data looking at the evaluation of putative prognostic factors, and I had the chance to be the discussant in this session. They found interesting findings from the ASCO Registry that focused a lot of community centers and patients who had active cancer, and they showed, results that actually corroborated to a degree the results from the Covid-19 and Cancer Consortium, validating some of the prognostic factors. For example, older age. The question remains, if there is any particular cutoff that really makes a difference in terms of prognostication, in terms of outcomes of patients with Covid-19 and cancer. They also showed an interesting finding that was also shown by Dr. Guarneri and colleagues from Veneto, Italy, that showed that over time in the pandemic, the mortality decreased, was lowered over time, went down. And we tried to figure out why this happened, why we had improvement in disease severity, Covid-19 disease severity and mortality. And I think it's a reflection of the improvements in the field, but we try to figure out how we can learn from these trends and how we can capitalize on that and improve the outcomes of patients with Covid-19 and cancer. We had some discussion that I did at ASCO 2021, and I invite the audience to look at this discussion to reflect with me about the different implications. The other important poster that was discussed by me was the work by Dr. Subaya and colleagues at MD Anderson Cancer Center, that they looked at real-world data of patients with with cancer regarding just in a non-trial design that was ancient invitation. This was not a clinical trial, but they looked at how patients with cancer did after vaccination with one of the mRNA vaccines against Covid-19. And overall, they showed that in this real-world setting, with a high number of patients, the vaccine, this particular mRNA vaccine, was safe and effective in patients with cancer, which was a very important finding because the representation of patients with cancer in the Covid-19 vaccine trials was very small. Less than 3% of patients with cancer were part of those trials that led to the authorization of this vaccine. So I think it was important data to show that in patients with cancer, this particular mRNA vaccine was safe and effective. And I will definitely encourage other institutions to look at their own data, report this real world evidence. And of course, with longer follow-up, they may have data updates and also look at other vaccines. And of course, I would like to see longer follow-up data, any potential breakthrough infections. But overall, I think this data substantiate and reinforce the high priority to vaccinate patients with cancer as soon as possible, because we know from the data from the Covid-19 and Cancer Consortium with my colleagues and other data sets that patients with cancer have worse outcomes when they get infected with SARS-CoV-2 virus. So I think it's important to prioritize those patients for vaccination in healthcare policies. So overall, I would like to congratulate the colleagues who had these important posters and invite the audience to review them, and hopefully we'll have more successes in the battle against COVID-19 with more lives saved and more prevention, and also look forward to seeing everybody in person when this is safe, likely in 2022 ASCO. Thank you so much for your attention.